Thank you very much for organizing this forum, very important and valuable forum, and also thank you for this opportunity for me to share some thought about the participation of people affected by leprosy in the field. We try to fight against the disease. And I would like to congratulate for the 140th anniversary of TLM, and feel very grateful that the long-term commitment to the field of leprosy and try to fight against the disease and bring a great chance, big difference for the people who have been affected by the disease. When we're talking about participation, I think that it has already been fully recognized that the importance of the participation or engagement of the people who had the disease, and it already became a global imperative that the solutions to the health issues had to be participating, build up the partnership with the people who had the disease. And this is not only in the field of leprosy, but in all the health issues. And when we're talking about in the field of leprosy, I think it has been foreseen long times ago, and even in 1998, Professor LeCharles has mentioned that we need to move about from the people affected by leprosy, move from a victim to a working partners. And he also mentioned that the collaborations of people affected by leprosy will be essential for ensure the success of our common goal for a world without leprosy. So it has been foreseen long time ago, and I think it's also been more and more recognized in the global strategy for further reducing the disease burden. It's also mentioned that people affected by leprosy have a substantial role to play in leprosy control, especially in the area of advocacy, awareness, and awareness generation and rehabilitation. But here, before I go further, I would like to mention that a few points we need to consider. When we're talking about leprosy burdens, very often we will think about what's the number of new cases detected every year, and what's the number of registered cases. And very often we will forget the third part of the burden, that is the people with disability affected by the disease. And I'm not sure if we know what's the exact number of these people who had the disease before and suffering from the stigma and also disability. Probably it is 10 times or 20 times or even 100 times more than we detect every year. If we reconsider this burden, maybe we had to think about what is our strategy had to be to deal with this issue and these problems. And it has been well recognized that the importance of participation, and even in WHO, they published a guideline for strengthening participation of persons affected by leprosy in leprosy service. And it seems that it's getting more and more recognized and feel that it's important to have people to participate. However, the reality, the real situation is probably far from our expectation. When we review all the national program, we can hardly find any statement or strategy about including people to enhance the participation of the people. And we try to review all the academic field that try to search some articles about the participation, but we hardly find any. Why is this? Because I think that we're still not really concerned about how to put it into practice and how we really try to engage people more effectively. And when we see talking about the people organization, yes, I think that there are few people organization, but it's I think much less than we should expect. in all over the world, I think there's only a few refugee organizations that have well developed and really participate and playing essential role in the fighting against disease. But then, what is the barrier for the participation? And I think that a few points we need to think about. First of all, is the mindset of the professional and the authorities. Do we really believe that the value of their participation? Do we really feeling that regard them as our partners? Or we just feel that they just our service receiver? And I think it's very important to change this mindset because we can really engage people and have them fully participate. And secondly, I think it's a lack of opportunity for them. When we try to develop our program, do we really consider them they can really participate? When we develop the program, are they involved in developing the program? And all of this was prevent them to really participate. And thirdly is the resources. I don't know how much we invest in the people. I think we invest a lot in our professionals. We train a lot of doctors how to deal with disease. We train a lot of us social workers, etc. But how much we invest on the people? If we're expecting them to really participate and contribute, do we invest them and give them more resources so they can develop? And of course, the last one is they have lack or limited capacity and confidence to participate and contribute. But I think this is also because of they don't have the opportunity. They have divided a lot of opportunity to develop themselves and build up their confidence. So I think this is probably the main barrier that prevent the people to fully participate. And there's also some issue I think we need to consider about the tokenism of the participation. We regarded that this is the good participation. First of all is we just try to find someone in some of the positions. And in fact, we just have someone in some position. Probably it seems that yes, they are involved, but they just follow what we want them to do and not actively involve and contribute. And secondly, I think there's also some that we try to invite someone in a consultation meeting that to invite them their opinion and ideas. But at the same time, when we don't have the good environment and let them can be fully comfortable to contribute, sometimes we're not able to really have them to contribute their idea. And very often, they will be only the very small group in this kind of meeting, and their voice could be very low. Then we cannot really hear. And also, in some organizations, they try to just have someone sitting in a board, but again, it's just a very small number and very small potentials of the people. And again, then they difficult for them to really contribute and participate. And finally, that I just mentioned about the guideline, and in our global strategy, there's a lot of very beautiful document that we think that the participation is important, but it's not really putting into practice. So I think there's all these things that we need to consider and how we can deal and make the change. And here I would like to give some of the suggestions that how we can really involve people into the participation. I think first of all, we need to try to invest on the people's group of people's organization. When we can build up their own organization and group, they can really try to push more and contribute more into all the policy and also the programs, etc. And secondly, we need to recognize and build on people's ability. Of course, we understand that they have limited competence and capacity at the moment, but I always think that they always have some kind of ability, especially their own experience. And we need to try to build up on their experience and ability. And we need to build on this so that they can build up their confidence and can be more contributed to our service. And then we need to create a friendly and comfortable environment for them to participate. Sometimes we feel that, yes, we invite people that join our meeting, but in fact, when a lot of professionals, we're just talking about technical terms and they're not able to really involve and understand, and that's not a good environment for them to participate. So I think this is also very important. We want them to really contribute. And lastly, we must be patient and allow mistake and failure. I know that there's, for example, TIM has been growing for 140 years to reach this point, to be such a big influence and good contributor to fighting against disease. But for many people's organizations, I think they're very, very young. Even HANDA, we have been working probably more than 10 years, but we're still very young. And we of course, we're all learning from the mistake, and we need time to grow and develop. So I think there's a few points I would like to raise for us to consider. And here I would like to give just an example of HANDA's example about how we have people more contribute and participate in our. So first of all, HANDA board is mainly consist of the people that are affected by disease. At the very beginning, it's about 90% of people, of the board member, are people affected by leprosy. But now, they have made some change. They also believe that we need to other contribution from the professional or other people. So now we have 2/3 of the board member, they are people affected by leprosy, so that they can really have their mind and their thoughts contribute about the development of the organization. And secondly, we try to build up the management team in different level. And that means that we have different level in leprosy village in all the province and counties. And we need to build up each village, they have the management skill and capacity. And this is also very important for them. They can really contribute and participate. Otherwise, they will always just act like a service receiver. So I think this is also very important for us. And this also, because our board members, they all come from different level, they vote and become the board member. So this is from the bottom up, we need to build up their capacity. And thirdly, even though HANDA now, we have a lot of professional staff, like we have medical staff, we have social workers, they have some professional training, but they're under the supervisions of people affected by leprosy. So again, the people, they are fully controlled, and they know, even though they sometimes, very often they will say, very grateful to the professional that come to working with them. But again, they can tell them that what we really need and what we want. So I think this is also very important. And lastly, that in HANDA, we also have quite a few people who had the disease before and be trained it and became key staff member. One of the example is that one of our chief technician, he is the manager of our mobile prosthetic workshop. And he is a person who affected by the disease. And his background is only graduated from middle school, but because we provide training opportunity, so he developed himself and now became the chief technician. So if we invest on people, they can contribute and they can continue really participate and also provide good service for people. And I think that this is some example that our board member that people affected by that heading the meeting and contributing, and some of the board member, and they try to supervise all the activity in the village and increasing the mutual support and communication, etc. And this is our technician that he got training and now became the chief technician and the technician for prosthesis and prosthetic suit, etc. And some other member, they also are person affected by the disease, and now became the key actors for all the service. So finally, I just would like to show some of my suggestion that, first of all, we need to have better understanding about the cell burden. That is, people who had the disease before but still suffering from disability and stigma. And this is probably a bigger burden than we just about just the new active cases or new detected cases. And secondly, we need to rebuild our program and try to remove all the barriers. If we don't remove the barrier, we will never get really participation. And so is that we need to invest on people's group, on people organization. If we want them to be able to contribute, we need to invest on them. And finally, we need to move from labeling to ownership. Thank you very much.